According to public health officials, flu season may be just around the corner in southwest Utah. Region 8 is seeing minimal sporadic reports of the flu compared to the south, where Texas and Louisiana are experiencing higher flu episodes.
We have 19 cases so far in our region, and that's actually well below this time last year or even the past few years, so flu season hasn't really arrived yet.
Washing your hands frequently can help avoid spreading of germs, especially for those traveling this holiday season. But Heaton said one of the best ways to prevent getting the flu is to get the vaccine.
Flu vaccine is recommended for everyone aged 6 months and older, but especially vulnerable populations like the elderly, the very young, pregnant women, and people that have a compromised immune system.
Despite recent health reports claiming the vaccine this year may not be conquering all the strains of flu, Heaton says the vaccine will usually help flu symptoms become less severe.
As far as side effects of the vaccine, it's very safe. Some people will describe local pain or swelling because it goes into the muscle on your shoulder. Maybe some mild fever or flu-like symptoms as your body recognizes that and starts to build up immunity.
However, the CDC is not recommending live flu nasal sprays again this year. It takes a couple of weeks for the vaccine to kick in, so now's the time to get the vaccine. Another cause for concern for travelers is the recent outbreak of hepatitis A. Hepatitis A is a common cause of food poisoning and is closely associated with contaminated food or water.
Hepatitis A is a disease that comes from the hepatitis A virus, and that affects the liver usually. And outbreaks can be explosive.
It can be contracted through sharing needles or through feces.
Hepatitis A outbreaks are closely associated with drug users or homeless populations because it can be influenced by hygiene, drug use, close quarters, those type of things.
Some of the symptoms include fatigue, diarrhea, vomiting, and nausea. And one of the telltale signs is jaundice, or yellowing of the skin or eyes.
Down here in southwest Utah, so far we've only had 2 hepatitis A cases this year, so not really confirmed that those have anything to do with the outbreak, but it's very wise, just like influenza, to do preventative things like hand washing and making sure that you're taking care of yourself.
The vaccine for Hep A is usually given with a series of 2 shots and is especially good for those who travel.
Between 90 and 100% effective for life. It's given in 2 injections, 6 months apart. It's part of the current required immunization list for Utah for infants under 2 and also for kids to get into school. So it's getting pretty good coverage now. If you haven't had the hepatitis A vaccine, it's a good idea to get it if you eat out a lot or travel. Again, that's for adults too. You get 1 vaccine, 6 months later you do a follow-up, and it has great effectiveness.
Many viruses can remain on door handles, countertops, and can live up to 48 hours. Heaton says it's a good idea to stay clear of those who cough and wash your hands frequently.
And so if you keep your hands washed and keep your hands away from your face and get immunized, your prevention chances are very high.
And if you are sick, the best medicine is to stay home. In southern Utah, Melissa Anderson, CEC News.